my child have measles? That is an important question. The most likely answer is no, and I'll explain to you why. But you never know, especially if your child has not received the measles, mumps, and rubella vaccine, it is possible. This video is being made in September of 2022. Per the CDC website, there have been 13 cases of measles in the United States this year, 2022, in 5 different regions. So at this moment, there are not any huge outbreaks of measles happening. If your child is vaccinated, has had both doses of their MMR, then the chances of them getting measles is extremely low. And the reason why is because this is a vaccine that works really well. You can feel confident that the MMR is going to protect your child from measles. However, I do know that there are some people who just aren't going to vaccinate. And so that's why we ask this question: does your child have measles? Again, it's possible. When your child is exposed to measles, it can take up to 7 days for them to have symptoms. The first symptoms look kind of like the flu. So they'll have a fever, runny nose, a sore throat. They often have a cough and red eyes. And then an unusual thing that shows up in the first symptoms is something called Koplik spots. So they're these spots that are inside the mouth, and they're kind of a bluish white spot. And it is said that if you see bluish white spots in the back of your child's mouth, then it's probable that they have measles. 3 to 5 days after they start having symptoms, like the fever and the cough, then we're going to start seeing the rash. And the rash starts around their ears or their neck and then goes down the rest of their body. They also can get an extremely high fever, up 104 and higher with this infection. But usually most kids are able to get through this infection pretty quickly. What we're worried about is it going deeper and causing things like pneumonia, or even going into the brain and causing encephalitis, which is rare, but it does happen, which is why there is the vaccine. If your child is showing any of these symptoms, especially the bluish white spots, I would have them seen immediately, but make sure to tell the office staff that you think your child might have measles, in which case they'll probably put your child in isolation pretty quickly and not have them hang out in the waiting room. The doctor will provide treatment as possible, acetaminophen to bring down the fever, possibly vitamin A, which can help take away the chances of serious side effects, and then anything else to make them more comfortable. Thanks for watching this video. If you found it useful, please give me a like, and I'd be honored if you'd subscribe.